Welcome everybody for watching a new episode of the Ocular Insider podcast about the dry eye and more. And my name is Peter Baranovic, and I have this privilege today to welcome in Morocco, in Marrakesh, during the Summer Congress 2026 in March. Welcome our special guest. It's Dr. Loubna Refass-Buret from Rabat. And we talking already quite a long time to meet each other, and so I'm very, very happy to meet you today. So please let me to introduce you a little bit, Dr. Loubna. She's a respected and prominent ophthalmologist and oculoplastic aesthetic surgeon based in Rabat, Morocco. She operates in her own cabinet, Ophthalmology Hayriat, which is the one of the first ophthalmological facility in the Riyadh district in the Rabat, which you said is the most beautiful town in the world. Definitely. Her specialties is definitely medical, surgical eye care, including the treatments of the argon yak laser, aesthetic surgery, refractive surgery, femtosecond excimer laser treatment, expertise in one of the most pioneering of contactology in Morocco, so I understood as well. She has a lot of new certificates from doing the aesthetic medicine in ocular phase, and especially an aesthetic on a blepharoplasty. I see nice videos, you have it in social media. I should not also mention it that you are very active on an awareness building and also communicating with your patients. So you are also passionate mother of your two nice children. And definitely passionate for your work. And I'm very happy to have you today.
Thank you very much for having me. I'm very happy to meet you, and welcome to Morocco.
Thank you. I know that these discussions I always try to lead very, very easy way and not have a basic frame. But tell us what is Loubna? What is the passion for the work you have? How did brings you to the ophthalmology?
What brought me to ophthalmology?
Yeah.
Honestly, by accident. The truth is, medicine has always been a passion for me. I've always wanted to be a doctor since I was, as far as I can remember. I only had a little period when I was like 11 years old when I was dreaming of becoming an astronaut because I was passionate about astronomy as well at that age.
Astronaut.
Yeah, but I have a terrible. I have car sickness, motion sickness. Okay. So I quickly understood that it was not something for me. So I went back to my first passion, was medicine. So
first option.
Yeah, so I always wanted to be a doctor, but I was thinking of becoming pediatric surgeon at first.
Okay.
That's what I wanted to do when I got into medical school. I have an uncle who is a very renowned pediatric surgeon in Morocco, and who does a wonderful job, and I was very close to him, my father's brother. And I was thinking of doing pediatric surgery. And then in Morocco, when we finish the general medicine courses, we have this possibility of doing 2 years of general residency. In those 2 years, we have 4 periods of 6 months.
Okay.
Where we do one training of surgery, any surgery, one training of medicine, any medicine, one training of pediatrics or OVGY, you choose between the two. And then the fourth one, you can choose whatever you want. And there is no need for a match or anything. Like if you dedicate those 2 years of your life to the public hospital,
okay.
And there's a contest before, it's very competitive. You have to go through it's a competition, it's un concours. And the number of positions is very limited. At the time, it was in '99 when I passed it. There were only 38 positions to fill, and there were 1,000 candidates. So you dedicate 2 years of your life where you're almost not paid. You dedicate them to the hospital, and you do those 4 6-month periods. But at the end, you have this 6-month period where you can choose whatever you want to test it. And if you like it, you stay in it. And if you don't, you choose whatever other specialty you want.
Yeah.
That's the good thing about it, is that it gives you like a carte blanche to choose any specialty you want.
That's very similar to Czech Republic.
Yeah,
They call it circle.
Oh.
So you circulate between the different professions,
Yeah.
and then you finally choose.
Voilà.
Body.
I mean, you circle also during your what we call externship, l'externat, in the 5 first years of medicine. But you don't have a responsibility. I mean, you have less responsibility. But when you finish those 5 years of general medicine, if you decide to dedicate those 2 years, then you circle, but you have a huge responsibility. And you have to be both in the department you are assigned to, but you also have to be 48 hours a week in the emergency department, like 2 times 24 hours. So it's very demanding. You work like 90 hours a week, but it's very, very, very rewarding education. Yeah, on an educational level, personal level. And it gives you that carte blanche to really choose whatever you want. And this is priceless.
Yeah.
And so when I did this training, I started with neurology, which I didn't like because it was quite depressing. It was frustrating because you would see so many patients you couldn't, you make a beautiful diagnosis, but you cannot treat them. And especially at the time, I'm talking about 1999, the biotherapies were not as developed as nowadays. And so it was very frustrating. So I didn't like it. Then I went for my pediatric, since I was planning to do pediatric surgery. I thought, okay, now I'm going to do anesthesiology and intensive care for pediatrics, and then I will go to pediatric surgery to test it. That was my plan. So the thing is, when I went to pediatrics intensive care and anesthesiology, I really loved it. And my mentor there was telling me, oh, but you have very good motor skills. I really see you in microsurgery. You should try ophthalmology. And I was like, what? Ophthalmology? No way. There's no way I'm going to do ophthalmology. No. He said, no, really, you're good in taking central venous, les voies centrales, venous veins, venous, les voies venous centrales, which are quite delicate to take in children, especially, and in neonatology also. And so he kept telling me, why don't you try ophthalmology as last training, the 6 months? And I was like, no. I'm going to pediatric surgery, and I'm going to stay for the last 6 months in pediatric surgery. It will give me, I would have heads up, and I would be ahead in the residency program.
Have a much more knowledge.
Exactly.
Much more hands-on.
Voila. So I went to pediatric surgery, and the big shock is that I didn't like it.
Wow.
I didn't like it, mainly because of, I think, the environment was a little bit deception
or
for me.
Emotional part that are the kids.
Also, the emotional part is true, and I felt like I felt frustrated that we were not helping them enough. I hate that feeling of I cannot be useful enough, and So really, I didn't like pediatric surgery. And then I was like, oh my God, what am I gonna do? That was my plan for day one. And I met again that professor that I really liked a lot, and it was a very nice person. And it was like, just try ophthalmology. I mean, you don't have nothing to lose. I mean, it's just 6 months, and if you don't like it, you can do anything else. And so I went to ophthalmology with really no conviction. And I just fell in love with ophthalmology from day one. I was like, this is exactly what I want to do. It's so rewarding. It's both medical and surgical specialty. You give back the sight to people right away. Of course, we also have some pathologies where unfortunately we cannot help people. But it's not every day that we see those pathologies. Most of the time we are able to prevent them and preserve the people's sights, or give them back the sights through cataract surgery, refractive surgery, and so on.
So finally, this is who you are, no?
Yeah.
this is what you are passionate. So, tell me, opening the eye clinic.
Yeah.
What is the most challenging part in these steps? Just to make this decision that I want to do it, or the first, couple months is when it starts running?
No, opening was a no-brainer. It was obvious that I wanted to be on my own. As I told you, I'm someone who likes to do everything by myself, and I'm very independent, and I like to do stuff on my own with my rules and be my own boss. That was not a question. What was harder for me, it was, I think, the managerial part of it, like managing human resources, because I need to have an assistant and a nurse in my office, and I don't like to manage people.
So this is I heard that also from my last discussion, that this is the most difficult. You are quite well happy with the profession you do,
Yeah.
but to be now a boss, to be somebody who control everybody is additional level
Yeah.
of having so many things around. But I'm sure that you already moved through this part and you have somebody who is helping you now.
Yeah, I mean, I've been in my practice for now, I don't know how many, 15 years now or so on, also, and yeah, so now I've learned, and thank God I have a nice team surrounding me. My husband also helped me a lot in the first years because he's an MBA, so he's good in management, and so he gave me a lot of good advice. And also I have a fiduciaire. How do you say fiduciaire in English? Like a professional I pay to also manage all this accountability stuff that I know nothing about. And I think this is something that's missing in our medical education, at least in Morocco.
Yeah.
They don't give us any education in how to manage a business, because they don't tell you that you are going to be a business owner.
Wow.
So we are prepared to be doctors, not business owners.
That's exactly the point that Dr. Natasha Pahuja from India mentioned as well.
Yeah.
No, that is something that nobody teach you.
No.
So would you need to go for extra education on running the business? As I also already said, that there are courses like that for sure, but it's a courses that you need to do afterwards.
Yeah. You don't have the time for that.
So what is the most thing that you do, like that you doing the most likely in your daily?
What is the thing that I like the most?
Yeah.
I think the satisfaction of helping people. I think this is the greatest part of our jobs as doctor, is that our job is to help people and make them happy, and see them leaving your office with a smile, and
So what is the secret of the to running the successful clinic in the setup like you? What is the secret
the secret of what?
for running the successful clinic right now?
Successful clinic? The passion, definitely. You need to have passion for your job. I mean, the worst thing to do is going through medical studies because, well, you were a good student at school, you had good marks, and you didn't know what to do, and you did medical school because you were able to do medical school, or because your parents wanted you to be a doctor. That's the worst thing to do. It makes you a very unhappy doctor, and not a good doctor, because that means you don't have that passion and that empathy, which for me are absolutely the key. Passion and empathy. If you don't have these two, don't go into the medical field.
Empathy, I believe, is the very important part of every work we do, and specifically to be a doctor. So, what?
And in dry eye, it's
In
important.
the dry eye. So that's what be my
suffer a
question.
lot.
Are there specific things that you always telling your dry eye patients or ocular surface patients? Because I'm sure that the discussion to explain to understand. So what is your setup for entering this?
I take 20 minutes with my dry eye patient the first time I see him, at least 20 minutes, if not more. Because these are patients who are often misunderstood, comment dire, unaccounted for? Not unaccounted for. I don't know how to say.
Expecting.
No, they are like, they are unloved patients, I want to say.
Okay.
I didn't make me so. I didn't make.
The most difficult.
Yeah, they are considered as difficult patients.
Yeah.
But it's not that they're difficult. They're misunderstood. Because often they have these symptoms and they don't know what it is. Like they say, oh, I have blurry vision, and they don't have red eye. They don't tell it's itchy. They don't tell you it's ça pique. Comment on dit ça pique? Well, itchy or whatever. And as you know, the majority of dry eye diseases are asymptomatic. There's a huge contrast between the symptoms of the patient and what we clinically find. Like you can have a punctate keratitis and the patient doesn't feel anything,
Yes.
but still they have symptoms. Oh, they have discomfort sometimes or blurry vision sometimes. They don't know why. And so these are patients who are often been to many doctors complaining of dry eye disease symptoms, but most of the time the ophthalmologist doesn't give them time to listen, doesn't listen to them enough, because we don't like chair time. They don't like to be sitting on a chair,
Yeah.
listening to the patient and not doing anything. What you must detect those patients and really give them chair time.
So it's like
Just let them. Yes,
psychology.
there's a lot of psychology in, and as you said, we need empathy for that. You need to have that empathy to say, okay, I'm gonna take the time to listen to that patient. Just let them talk, even if you think that some of their symptoms are ridiculous and have nothing to do with dry eye. Just let them talk, because you might find something that can,
I see this even investigating or making the measurements during my trials. I see how interesting it is to when they say, oh, this is my daily time. This is when I see the problems. I'm maybe and then they consider, and finally at the end, you can maybe guide them better because they will understand what problem they have.
Yeah, and you have to really explain to them how to do the cleaning of the eyelids, how to do the massage. You have to warm up for 5 minutes at 39 degrees Celsius at least, and it's better to buy a heating mask. If you don't, you have to use the thermos with a clean cloth. And here's how you do the massage. Often they're like, oh yeah, I do this. No, it's not like that. Here's how the meibomian glands are. Lesson of anatomy 101. Here how your meibomian glands are. So the massage has to be like this, and like that, and this is the symptomatic treatment. But then we have le traitement de fond, which is the pulse light. And here's why it works, because you have the thermal effect and you have the neurological effect. And so it's going to really make your symptoms better. And we're going to combine it with red light therapy. And they're like, oh.
So managing the expectations, this would be the second thing. Would you try to say?
No, c'est pas managing the expectations.
So explaining the process of
Explaining the process, exactly. Really take the time to listen to their symptoms and to assess the diagnosis. Well, assessing the diagnosis clinically is quick and easy. I mean, you do Sherman, you do breakup time, and you check for the
quality of the lens,
quality of
the oil, the main oil.
I mean, it takes 2 minutes on the slit lamp.
Yeah.
But what should take more time is listening to the patient, taking the time, because it's part of the treatment also. It's the psychology of the patient, and explaining the treatment to them. Really, we have to take the time to explain how to clean up the lashes, how to do the massages, and of course, comment on dit le traitement de fond en anglais? Like you have the symptomatic treatment and you have le traitement de fond.
Yeah, but symptomatic
Il y a le traitement symptomatique et le traitement de fond. Like the pulse light is traitement de fond.
Oh, it's one of
For treatment, the core treatment, voilà. So, so here's a symptomatic treatment that you do at home, and here's how to do it. And that is a core treatment we're going to do, and here's why we do it. Because it's going to help you do this and this and that. And they're like, of course, it makes sense. It's logical.
So when you do all these steps,
Yeah.
do you see that patients are more cooperative?
Of course,
Yeah.
definitely. Like at first you tell them, I have this machine I want to do, and it costs 1,200 dirhams. They're like, definitely not. You just want to make me pay something that's not reimbursed by Social Security, and I don't have the money for that. but when you take the time to listen to them, when they see that you are giving them time to tell you about their suffering, leur souffrance, their suffering,
You're the separate.
and then taking the time to explain the treatment and the two parts of the treatment, what they have to do at home and what you are going to do in your office and why you are doing it. When they understand, they totally adhere to the treatments. And it's also like psychology 101. We know that in any disease, 40% of the treatment is the relationship between the doctor and the patient. So really, for me, dry eye disease is a very c'est un exemple parlant. It's a very speaking example of the importance of the relationship between patient and the doctor. We really have to take the time. And
I do believe that this is due to the point that you building always relationship in this kind of things, because it's a multifactorial. Patient needs to understand that without his personal care and focus, nothing will change, specifically if he spends a lot of time on computer, or is a heavy smoker, or he has a problem with the food addiction. So I believe this is the one of the core of the problem.
Absolutely. And also, I mean, it's often linked to an inflammatory disease like rosacea, and in rosacea, stress is a very important factor. So we need, if to lower the patient's stress level, you need to reassure him and explain, and it's part of the treatment.
So when you measure rosacea, it starts with the dermatological issues like acne, or it's coming. You think it's more of the immune system problem and an inflammation.
Yeah, and honestly, I diagnose more rosacea than the dermatologists do. Okay. Most of the time, like I would say 80% of my rosacea patients, I'm the one who sends them to the dermatologist. Okay. It's not the dermatologist sending them to me. And I have a lot of patients that I have diagnosed with rosacea years ago, and I tell them, okay, you have eye rosacea, and we need to do this and this and that, and pulse light and so on. Yeah. And they don't do it because they don't have the money, whatever. And they come back after 1 or 2 years because in the meantime, they had acne onset and they went to the dermatologist.
That's what I was going to mention. So do you see a lot of the epiretinea coming? The epiretinea is the one which looks like acne. This is ocular rosacea.
Acne rosacea.
Yeah, and then you have a telangiectasia, which is like the small blood vessels.
Which I also treat with my photon laser. Yeah.
But it's also working with the IRPL. It's very, very effective.
Yes, I started doing it, but I didn't have as much results as when I really cauterize the vessels with laser.
When you're treating the acne patients, what is the time of setting out the standard medication treatment? Because those patients sometimes also taking the medical treatment, other medical treatment. What is your advice?
If the dermatologist prescribed the oral doxycycline, then I wait until they're done with it, because it's a photosensibilisant. Okay. So I tell them, okay, well, when you finish the treatment,
those here,
then you come back and we'll see. So I don't.
But the worst thing is that using these pills will definitely affect the Meibomian glands dysfunction. Yeah. And that's another effect. You try to decrease something which will affecting the function in the whole, lacrimal unit.
Oh, you're talking about the retinoids, not the doxycycline. Because in rosacea, usually they prescribe, in some rosaceas, they might prescribe retinoids. Yeah. But in most rosacea, they tend to prescribe cyclins. Okay. And cyclins, there's a photosensibilization with cyclins, so it's better not to use pulse light when they are under treatment. It's
increasing. So you starting using the pulse light how many weeks after they finish?
The cyclines? Yeah. Oh, at least a month after. Yeah. Yeah. What are your standards? What are your recommendations?
No, I would definitely do it minimum 2 weeks.
Yeah, I do it a month. Yeah.
Because you can still have a remaining volume in a blood circulation. Yeah. So one is everything is flushed out.
But if it's retinol, I do pulse light.
Yes, there is no problem.
There's no problem with retinol.
Because it doesn't increase the photosensitivity.
I do it no problem. Even laser now we can do it under retinol.
Do you have many negative, response from the patients so far from all these years?
Honestly, no. Honestly, no.
So
I mean, the worst is that oh, I didn't feel any effects. Yeah.
Okay.
And I'm like, really? And I'm like, okay, let's measure your breakup time. Remember how much did I tell you the other time? It told me this and this. Well, this time it's much better, almost 8 seconds.
Okay.
In that case, it's interesting to have an objective test like the tear check.
Yeah, exactly.
But honestly, I don't like. It's not a good investment for me. It's too expensive for what I'm gonna get from it. You know, if it was available in one of the clinics I operated, for example, I could send my patients to do it. But to have it in my clinic alone, I'm not going to have a good return on investment with the tear check.
And I believe this is something that we could maybe talk later. And I can explain you how those things can work more easily.
But also because I've tried it. I don't know if you know, but like when was it? Like 4 years ago, maybe. I was doing a little study about the effect of Botox on the ocular surface, because you know that Botox can block the function of the meibomian glands, but also the lacrimal gland.
The level of botulotoxin is really interesting.
Yeah.
It can block for a couple of weeks.
Yep.
And what is interesting is never disappear from your body.
Yeah.
And now the new study also showing that it's decreasing the empathy.
Botox is decreasing empathy?
Yep.
I don't think so.
As a function on the brain.
No, I don't think
That's
so.
what I just heard.
No. I think
My wife is taking
No.
the Botox.
I saw this. I mean, that was a hoax, actually. It's not decreasing, and it's not true. Because I just remember this story and what the
So
hoax.
my wife is not empathic because of that.
No. It's not because of that. But it definitely decreases the meibomian gland and lacrimal gland, and it's been proven. There was a large study that was done in Taiwan.
Neural system.
Yeah, it's an anticholinergic, so the meibomian glands and it's like
Parasympathetic system is blocked.
exactly. But it's only during the first month, and then it goes, and then it's good. So whenever I do Botox to my patients in this area, I always prescribe artificial tears, and I explain that they could have eye dryness, even if they don't feel it, they should hydrate.
Maybe,
So when I
maybe
was
you should
doing-
combine with IPL, to stimulate the glands much.
Well, if I'm suspecting a previous dysfunction, then I do treatment. But the thing is, they want to keep. They cannot have the money for Botox and IPL at the same time.
And this is really interesting. But I maybe have an idea for you. But
Okay, good. Because when you tell them you have to pay 3,000 dirhams for the Botox and then you have this treatment at 1,200 for a session, they're like, yeah, but I want my Botox. I don't care about dry eyes. I don't want wrinkles.
because are more important.
Okay, I get the drops.
I could keep crying.
Yes, exactly. Voilà.
If I would be beauty, I can keep crying.
Important. Just let me get blind or beautiful.
No, I never see myself. No. So with full respect, the big
Yes.
side.
So they landed me a tear check in my office for a little study I was doing about that on my Botox patients. And the problem I've noticed is that it wasn't very reproducible. Like I didn't have reproducible results with the tear
4
check.
years ago,
Yeah, that was
I
4
can
years.
imagine that.
Oh, okay.
So we have now fifth generation of the software.
Yeah, it wasn't reproductive, so I was like, oh, come on. Like, I don't have the same results as 5 minutes at an interval.
Also, what we saw, there are a lot of mistakes done during the measurements. We also find it. So now the new setup is totally different, and it's development. We see the instruments, we see the failures, and now we have a fifth generation already of software, which has a lot of new features. Even during the automatic detections of the blinking, we already see when you can really make the false results. So specifically when you do a fast blinking, they are uncompleted. And I'm sure this is one of the reasons that we have a dry eye developing together with the CBC syndrome. It's due to the incomplete blinking.
Yeah.
So if you do incomplete blinking during the measurement, this will fake every measurement in every machine. So that's interesting, coming all these aspects. So I see your nice outcomes from Calasium treatment.
Yeah.
You started recently. What do you believe? And I think is also again one of the skin problems, which is it mostly effective or affecting the moment side? because there's also probably a part of the hormonal changes and some immune system problems. So what is the key motivation to doing the non-surgical treatment for you for chalazion treatment?
Um, well, practical reasons. I mean, if you're going to do it surgically, you need to make a reservation the patients come into your practice and you treat them there. They come to your practice because you are next to their workplace or their house. I mean, you are the ophthalmologist of the hood, of the neighborhood. And so instead of telling them, okay, now we need surgery, we need to set up an appointment and go to the clinic to do surgery in the OR, because I don't do it in my office. I don't like to do surgery in my office. I know that some doctors do chalazion or even pterygion in their office, even blepharoplasty for some.
Okay.
I don't. I like to be in an OR for any surgical
Purposes?
Yes. So
No,
yeah,
because of the sterility, because of the anything can change.
Just a vagal shock, Oh, they could die from a vagal shock. So I don't want to take any risk on my patient. I have an obligation, like in medicine, except for aesthetic medicine, we don't have an obligation of results, but we have an obligation of means. Legally, we need to take all the means that are available on earth.
Yeah.
To give the best treatment to our patients in the best security environment. So obviously it's so much easier to have safe treatments that can be done in the office and efficient treatments. And yes, I'm very happy with the efficiency of the AI in chalazion treatment. Yeah.
So only with this limited number of flashes, you're receiving a very good outcome.
Yeah. And as I told you, even after one session, that was amazing.
Yeah, I'm sure because of the different treatment, abilities in the same moment, different, yellow, red light and invisible all together, treating in one moment. I think that's why and also exposure of the time, which is enough and also safe. As you said, there is no contraindications. Only the Fitzpatrick skin type could be the contraindications.
And yet, honestly, in Morocco, everybody is Fitzpatrick 3 or 4, most of people. And even I tend to go now, honestly, I tend to go with the highest level for everybody. And I don't have any problems of pigmentation or whatever.
Do you find any the big problem of explaining the patient the procedure? Are they afraid?
No, not at all. I explain to them. I show them the brochure, and I explain to them. And no, not at all.
Yeah.
Because people know that I've already heard about pulse light, for aesthetics. And I just said to them, it's not the one that we use for hair removal.
Okay.
It's one that's specifically been studied for the eyes. And here's how we do it. We put eye shield to protect your eyes, and we put the gel to protect your skin. And is it painful? No, it's not painful. It might burn a little bit, but sting a little bit. But no, we do not problem. People accept it.
So these things like chalazion, ocular rosacea are really add-on procedures and protocols that they can really extend the usability of the device like an IRPL.
Yes.
And I believe so. So is there any other treatment that you also adding to your standard protocols?
Yes, definitely. I add red light therapy.
Okay.
Especially for meibomian gland dysfunction that are linked to rosacea. So I always add to my protocol red light therapy. Always, like every session of EI, I do 20 minutes of red light therapy. And even between the session, I ask my patients to come to my office for red light therapy, like weekly sessions between the AI sessions. And I really, there's a synergic effect because it also lowers the inflammation of the whole rosacea in the face. And also my patient, they appreciate the fact that I'm offering them a free complementary treatment that's synergic to the AI treatment we are doing.
Are you seeing that I like when the people thinking in a wide perspective, because the treatment possibilities and the different let's say the protocols can increase the chance of healing the patient's spinal. My next question would be one of the last one, and I hope that you've been enjoying this discussion so far. What is the situation, because I always ask this regarding the country where you're living. Is in Morocco also increasing the prevalence of the dry eye dramatically like other countries? Do you see this also young population coming more and more?
Absolutely, yeah. Absolutely, yeah. More and more dry eyes, and as everybody, when we use of computers, so evaporative dry eye, which tends to decompensate any underlying little inflammatory disease or maybe hormone dysfunction that could have been done unnoticed otherwise, and they tend to decompensate earlier because of the overexposure to computer space, definitely.
Yeah. Okay. Thank you so much. I know this would be even more, but it's start to be very crowded here. People like to also express themselves. I'm very pleased to have you today here.
Pleased to have you too.
And I'm being such a big honor, and I hope that we will meet each other more frequently and share the knowledge or the new things that also.
Maybe in Rabat next time, the most beautiful city in the world.
I love Morocco. It's such a beautiful country.
Thank you.
And Rabat, I heard a lot about the Rabat.
You should definitely come visit.
And I'm searching into having more and more to discover. Like my wife said, okay, you want to be today alone in Morocco because of a lot of fun. Yeah, I'm surprisingly it's also cold these days, but it's because of rain.
It's unusual.
But it also brings the fuel for the flowers.
We very happy with the rain we had this year. It's really it has 7 years of drought, so this is awesome for us.
So some tearing is positive, something like a rain. So hope that our patient would be crying less and less. So and I wish you the most of the successful treatments and also happy patients, and hope that you enjoy us and watching and on YouTube channel and also listening on Spotify. Our today discussion with Loubna Refass from Morocco, Rabat, and I hope that you can see us again and visit us maybe in the next episodes this year. And I hope that we would have a chance. Maybe throughout WOC would be nice, interesting to meet each other and record some more. And so thank you so much, and see you next time.